Hi, Dr. Pelto here. Here's a patient. She had a matrixectomy a few months ago, and this is a little piece of nail that's grown back, and this is called a spicule. This is what we talk about when we say that sometimes a nail can come back like this. It doesn't happen all that often, but you can see it right here. So I've already numbed the toe up, so it's not painful at all. I'm putting this little tourniquet around, and then we're just gonna, with this little spicule, you can either trim it back, but it'll keep coming back, and so that's where I recommend just kind of freeing it up. And so what happens is when you put that medicine, which I use sodium hydroxide, you try to get all the cells, and you can see the center part, there's no nail growth. It's just a little edge right here. There was a couple of the cells, and it caused it to grow. So we have to reapply it. So it happens occasionally that way. See, and there's still a little piece. You can't leave anything in there. That's the challenging part, because if you feel anything, is that okay?
I'm fine.
Okay. There it is. See that?
Wow.
So that's the piece of nail that was kind of stuck in there, that little piece of nail. That little, we call it a spicule. And this is just some skin around the edge. And that's exactly what we were looking for. And so sometimes there's a couple of reasons that this can happen. One is that when you're taking it out, you leave a little piece of nail in there, and then the acid can't get to the nail. Or it's just that when you're putting it on with the Q-tip, you don't put it everywhere. So this is just some hard skin here left over. So those are just some calloused skin. So I really just kind of scrape down. I want to make sure I get all that roughed up and freed up. Now, there are a couple of chemicals that are used to kill the root. One that's very common is phenol. We used to use phenol in the office, but I just turned my timer on for 30 seconds. We used to use phenol, but it used to expire too soon. That's why we stopped using it. Some people ask me that in these videos. Why don't you use phenol? We use sodium hydroxide because it lasts longer without expiring. That's the main reason, because it's really hard to get rid of these chemicals. And I just turned and so usually for sodium and phenol, you put it in for usually a minute, or use a couple of Q-tips. This is one Q-tip for 30 seconds, and I try to really push down into the edge there. And that's the timer. I do it about 30 seconds, and I really want to get all that so that those cells are die in there, okay? And then what I do is I take a little vinegar. So with phenol, it's a phenol alcohol procedure, and this is sodium hydroxide with a vinegar procedure. That's the main difference. Okay, so let me just... So that's how it looks now. And I'm going to put a little, this is just the Amerigel stuff that we use to helps with healing. And I put that right over that, so. So once this comes out, this was to stop the bleeding, and once it stops, it's going to start bleeding once I take that off. So I put a lot of gauze on here, and then I do some tape. You can use Coban, you can use a lot of other things. People sometimes ask, why do you use this? You need to, I do a lot of gauze initially so it doesn't bleed through. And then, but tomorrow all you need is a little bit of gauze and a Band-Aid. And I put this over the top, and I recommend kind of taking it easy. Today. And then you can see I always like to do my special little thing here you'll see at the end for my patients. And then, all right, here's the best part. And then we can, let me see if I can write this upside down. Did I do the S right? No, does it say Go Pats? Yeah, because they just backwards, but this because they just won the Super Bowl.
Go Pats.
Go Pats. Okay.